Hello, everyone. Thank you for joining us for the POCUS Certification Academy for today's informational session. My name is Tiffany Claiborne. I'm the Outreach Specialist for POCUS Certification Academy. I'll be today's moderator. The webinar is now beginning, so all lines will be muted. Please use the Q&A box for any questions or the chat box for comments you have throughout the webinar. We will also leave room at the end for your questions, and we'll answer them live.
Thank you for joining us today. This informational session will provide a comprehensive overview of the POCUS Certification Academy, including program specifics, education and learning resources, and community initiatives. We will have time at the end of this session for your questions. However, feel free to submit your questions throughout this presentation using the chat feature. My name is Jasmine Roquette. I'm the director of the POCUS Certification Academy. In addition to myself, Daria, Lori, Tiffany, and other representatives from the POCUS Certification Academy will be available throughout this session to answer your questions. Intellos is a nonprofit mission-driven organization that creates global standards of excellence in healthcare. We are led by a diverse volunteer governing body that drives the strategic direction of our work and ensures our offerings represent the global clinical community. This video outlines how Intellos uses ultrasound to fuel the global health community and ensure equitable access to quality care.
Ultrasound is a powerful medical imaging tool used to detect and diagnose medical conditions in men, women, children, infants, and fetuses. Ultrasounds performed by educated and trained healthcare providers who have verified their knowledge, skills, and abilities increase the quality of care, improve patient safety, and save lives. Until recently, most patients received ultrasound care in hospitals, medical centers, doctors' offices, and clinics. In the last few years, thanks to innovative device manufacturers and technology advances, new, powerful, affordable, and handheld ultrasound machines have been developed. These new pocket-size ultrasound machines are quickly making their way into the hands of medical providers in every imaginable healthcare setting around the world. The possibilities for better patient care and improved global health are boundless. But technology by itself is not the only answer. We must assure that all healthcare providers that have access to ultrasound technology also have the critical ultrasound education, training, and verification of knowledge, skills, and abilities vital to deliver quality patient care. The lives and futures of patients around the world are counting on us. This is the Ultrasound Proficiency Grand Challenge. We believe that by 2030, every person everywhere in the world should have access to ultrasound care from educated and trained medical professionals that have certified their knowledge, skills, and abilities. We invite you to join us in the Ultrasound Proficiency Grand Challenge. Together, we can build a healthier and safer world for all.
To achieve the goal of ensuring every POCUS user is proficient and certified by 2030, we will need to work collectively with POCUS communities, including local and regional experts, to develop ultrasound standards that reflect the needs of the community. We will collaborate to educate and train clinicians globally, verify healthcare providers' knowledge, skills, and abilities through assessment and certification, and leverage and assist in the distribution of ultrasound technology and equipment. By doing this, we will continue to cultivate a community of proficient POCUS users that are able to learn and support each other. The Intellos POCUS Certification Academy is focused on upholding standards of excellence in healthcare by validating clinical proficiency in POCUS. Achieving this goal starts with you. Our certificates and certifications are developed with rigorous standards and align with the global accreditation requirements, ensuring every certificate holder demonstrates the skills needed to effectively use POCUS to elevate the standard of care globally. Unlike other certificates that are available to specific provider types or specialties, we understand that POCUS is used across specialty, provider type, and location. Therefore, we've designed the POCUS Certification Academy for anyone that uses POCUS for therapeutic and diagnostic decision-making. With the use of POCUS growing exponentially and the applications evolving daily, we continue to see new users obtaining certifications to validate their POCUS abilities. With about 1/3 of our certificate holders representing countries and territories outside of the U.S., we understand the global impact POCUS is having on patient care. Regardless of your role, the POCUS Certification Academy has opportunities to support your unique practice setting. Within the POCUS Certification Academy, we have several programs. We will start with an overview of our certificates and certifications. All of our programs are developed with POCUS community volunteers for POCUS users like yourself. These volunteers identify the content areas we develop, as well as building out our individual assessment questions, clinical cases, and peer evaluation requirements. Our first offering, which is the prerequisite for all of our other clinical certificates and specialty certifications, is the POCUS Fundamentals. This certificate includes about 4 hours of online learning. The topics range from physics, instrumentation, safety and bioeffects, and much more. This certificate provides new or established users with the foundational knowledge needed to proceed with practicing POCUS in any clinical setting. At this time, we currently have 14 clinical certificates. They are comprised of simulated clinical cases and peer evaluations. The number of cases range from 4 to 10, depending on the complexity of the content area, and are designed to replicate the clinical encounter you may have when seeing patients. The questions include identification of anatomy, interpretation of sonographic findings, and synthesizing information to make a diagnosis, leveraging the ultrasound scans. To earn a clinical certificate, you must successfully complete the clinical case assessments and peer evaluation. More details about each of the clinical certificates can be found on POCUS.org, including the number of clinical cases, the prerequisites, as well as the specific content outlines, and much more. We currently have 7 specialty certifications. The specialty certifications consist of a combination of the clinical certificates that made up those individual content areas. So the specialty certifications are a combination of those, ranging from MSK, our generalist, emergency medicine, and the rest of them that you can see there on the screen. The makeup of the requirements to earn the specialty certifications are similar to the clinical certificates, with the addition of the video submission. For each content area within the specialty certification, you must submit 1 normal scan and 1 scan with pathology. A clinical review of your submission is then conducted, and additional feedback is provided if needed. To earn the specialty certification, you must successfully complete the clinical case assessments, the peer evaluation, and the video submission. Additional details about these offerings can be found on our website as well. We are regularly launching new offerings to support the evolving applications of POCUS. Check in regularly for new offerings, and feel free to email us if you would like to make a recommendation. To apply for the POCUS Certification Academy, there are 5 quick and easy steps. Once you've completed your short questionnaire to create an account, you will select the green Apply for Examination button. This will direct you to the page where you can select the POCUS certificate or certification you wish to pursue. Please note that the POCUS Fundamentals is the prerequisite and must be successfully completed before any clinical certificate or specialty certification can be applied for or started. Once the certificate you're interested in pursuing is selected, you will complete steps 1 through 4 in the application process. These steps include attesting that you've met the prerequisites and experiential requirements, which are those number of cases that you have to have had completed within the last 2 years, and providing the names and emails of your peer evaluators. If you don't have the names and emails at the time of your application, you can always go back in later and add the names and email addresses at a later time. Finally, you will make payment once the application steps are completed. You will have access to your assessment and will be able to start your assessment immediately if you choose, or you can choose to start your assessment at a later time. You can choose to complete your assessment in one setting, or you can come and complete various components and start and stop within the time frame that you were allotted. 90 days for the clinical certificates, 180 days for the specialty certification, and 30 days for the POCUS fundamentals. We believe that learning POCUS is a lifelong journey which requires ongoing practice and learning. Our assessments are built to our assessments are built to be just one component of your POCUS journey. In addition to our certificates and certifications, we offer educational resources. To aid in your POCUS proficiency journey, the POCUS Certification Academy offers learning resources within our educational library. This curated collection of learning resources are designed to benefit healthcare providers, residents, students, and anyone who uses POCUS, with the goal to help them improve global health through the expanded use of POCUS. The learning library includes podcasts, guides, webinars, blogs, and clinical case challenges, ideal for self-learning and exploration. If you are looking for a more comprehensive learning solution, check out our POCUS Education Provider Program. This program is a solution for medical professionals seeking quality professional point-of-care ultrasound education and training. Our team works with a network of programs to provide quality education and training for new and advanced POCUS users. For clinicians, this means a streamlined pathway to POCUS certification and access to group training. By working with the POCUS Certification Academy, we help you streamline the POCUS proficiency journey by helping you obtain POCUS training and certification in one space. If you are looking to engage with the POCUS community and lend your expertise to improve equitable care globally, we invite you to explore volunteer programs. We couldn't do what we do without our volunteer leaders who have a passion for advancing POCUS around the globe. We offer several volunteer opportunities that can be customized to fit your busy schedule. These opportunities include blog writing, webinar hosting, case reviewing, and developing additional content, and much more. Another volunteer program is our POCUS Ambassador Program. Each ambassador represents a nation within the international community of ultrasound practitioners. POCUS ambassadors are advancing healthcare systems in their nations by building accessible pathways for learning and practicing ultrasound. Currently, there are 19 ambassadors from 19 different countries. Connect with us on social media to stay up to date on the POCUS community. We are on LinkedIn, Facebook, and X, formerly known as Twitter. As an organization, we recognize our goal is lofty, and it will take collaboration from others within the ultrasound space to help us achieve this goal. Therefore, we collaborate with education, software, AI, and device organizations to bring products and services that will support the POCUS community. Some of these collaborations include our network of POCUS education providers that provide vetted educational options. We also bundle our certificates with manufacturers to ensure the responsible distribution of ultrasound devices. And there are opportunities for content-specific training and certification packages from online reputable educational providers. I know we covered a broad spectrum of information, and we are happy now to open the time for questions.
Thank you, Jasmine, for a great overview of our program and offerings. We will now begin the Q&A portion of our session. If you have any questions, please leave them in the chat box, and we will try to work them into the Q&A session. Joining us today to answer your questions are a few of my colleagues and team members of the POCUS Certification Academy: Jasmine Roquette, Director; Daria Valenzevic, Global Learning Program Manager; and Lori Global Rise, Global POCUS Assessments Manager. Welcome all. For our first question that we received prior to this webinar starting is, can they choose the date to start or must they start after registration? I'm going to start with Jasmine to answer this question.
If they choose to purchase through our learning management system, through the steps that we outlined in the presentation, the time to start the certification starts immediately. So going back to the time allotted, they would have 30 days to complete the fundamentals, 90 days to complete the clinical certificates, and 180 days to complete the specialty certifications. However, they can choose to start that assessment immediately, or they can come back and log in at a later time to proceed with their certificate or certification, but they would have to complete within the time allotted, depending on the offering that they sign up for.
Great, thank you. Next question is from one of our attendees from Turkey. Thank you for joining us. The question is, can you give more info on peer evaluation? I live in Turkey. Who would be potential peers to evaluate me? I'm going to pass that to my colleague, Lori.
Hi, thank you. So peer evaluators would be anybody with a clinical background in ultrasound and then are familiar with your abilities. So anybody who's available to your surroundings, it could be a coworker, it could be a hospital or an educator, as long as they're familiar with your abilities.
Thank you. And then we also had a part 2 to this question. Is there an ambassador currently in Turkey? And the answer to that is that we'll get back with you. I'm not sure if we do right now. We do have other ambassadors in Europe, but I'm not sure if we have one in Turkey. So we'll have to get back to you to answer that question via email. Thank you for that.
And Tiff, I can add to that.
Please.
They can always go and visit our website, POCUS.org, and they can see the countries all of the ambassadors represent and each cohort. So that information is available on the website as well.
Jasmine. Next question. What are the prerequisites as a foreign physician, and are we able to work in USA as an ultrasound tech? I think this is a team effort, so I'm going to start with Lori, and I think Jasmine might can add something to it.
Yeah, so the prerequisites are available online. Just it varies depending on which clinical offering you're wanting to purchase. We do start with the POCUS fundamentals. That's a prerequisite to take any of our clinical certificates or specialty certifications. So you have to successfully pass the POCUS fundamental certificate, and then you also have to attest to being a part of interpreting in the scans of diagnoses for a certain number of scans within the last 2 years, and then also a practitioner within good standing. And we're a global organization, so we do have people from around the world that take our exams. And Jasmine here.
Yeah, definitely. So to reiterate what Lori said, we are a global program. So the requirements we have for anyone is the same, no matter where your practice setting is. There's the prerequisites of the fundamentals, as well as meeting the minimum number of cases. And those number of cases vary depending on the clinical certificate or certification that you're pursuing. In regards to the second part of the question about, does that give the ability to work in the U.S. as an ultrasound technician? There's a difference in the scope of practice between the ultrasound technician or a sonographer versus a point of care ultrasound user. And so to work as an ultrasound technician in the US, in most states, it requires you to take a certification from one of our sister councils, ARDMS. So we would encourage you to visit ardms.org to learn more about those offerings if your goal is to work in the US as a sonographer or ultrasound technician.
Great, thank you. Next question. Are there available study materials or past questions to ensure 100% success? Lori, can you take that one?
So I would guide people to the POCUS.org to review our content outlines. And also we have available just the experience of what you'll go through for the clinical case assessments. There are scenario-based assessments, so it's situational, where you would be answering those questions. And we also have additional resources online within our education division, where you can utilize those resources as well.
Thank you. Question that came in the Q&A box: is there free training and certification? It's my colleague Daria. I believe she can talk more about training opportunities and education. You can't see her,
yes,
but you can hear her.
Yes, I apologize for technical difficulties. My camera, for some reason, stopped working, but definitely happy to share that we do have a range of free educational resources available on our website under Resource Library. We do have a very extensive library of webinars, blogs, infographics, as well as cases that you can practice and knowledge checks. However, there is no free formal education or training. We can definitely work with you to find you the best cost-effective solution. So feel free to reach out to us, and we'll work directly with you to find something that fits your budget and needs.
Thank you, Daria. Next question. So after the certification, is it renewable every year? Lori?
So we require certifications. We go through a maintenance of certification every 5 years, and that's for our clinical certificates and specialty certifications. So you're attesting to your abilities, and then you are also taking online quizzes to show you're demonstrating that you're keeping up with your point of care ultrasound skills. And then we also ask for specialty certifications that users provide professional development. So if it's professional education or just professional experience, we will ask for that.
Thank you. Next question. Is it possible for one to pay for 2 certifications under the current summer discounts? I could take that one. Absolutely. You have to start with the POCUS Fundamental Certificate. That is the starting point. And then if you wanted to add on a clinical certificate, you absolutely can. And you can apply the discount code mid-year 24. All right, let's move on. These questions are coming in, so thank you so much. And I appreciate your patience as I work my way through them. Next question. This is for Daria. Is there any partners in India who provide hands-on training along with the POCUS course?
Yes, we absolutely have a partner in India. Again, I would encourage you to check out our POCUS Education Provider Network page. It lists all the countries, but we have a provider in India, and I'm happy to send some additional information after this call.
Great, thank you. We have a question. I would like to complete the course, but my question is, can I complete it completely online without visiting any other country without ambassador here in British Virgin Island? Thank you. So I think I understand your question. And yes, our course, and I'll let the rest of the team members answer this, our certification program is 100% online. So you can complete it online, and you don't necessarily have to have an ambassador in your country in order for you to take our certification program. I believe I answered your question.
You did.
Thank you. Someone asked in the chat, what's the name of the organization again? We are the POCUS Certification Academy. All right. Give me one moment just to filter through these questions. Someone had another question about, is there an ambassador right now in Ghana? And I believe there is an ambassador in Ghana. But like Jasmine, our director, mentioned, you can also go to POCUS.org to our ambassador page, and you can see the full list of cohorts that are in every country as represented. If you have any other questions, please
can I
chat them.
answer one?
Sure.
So I see one in the chat that says, are there waivers or sponsorships for Africans? So we do understand, because we're a global company, that there's different economies, and we do follow the World Bank for discounts, and we also offer scholarships through our Intellos Foundation. So if you could email us at POCUS@intellos.org, we'd be happy to provide you with that information.
Thank you, Lori. And then it looks like last question that's coming in is, can I take an evaluation for the fundamentals without going through the course? I already took POCUS fundamentals training without certification.
So I'm going to answer that, if that's all right.
That's fine. Go ahead.
So you will have to take the POCUS Fundamentals certificate. We do have options where you can test out of the educational modules. So there's 2 questions, and if you pass, you don't have to review those educational modules, and it will lead you right to the 35 question summative assessment, but you will have to take that.
Thank you. Daria, we have a question coming in. Is there any in-person training opportunities?
Yes, as I mentioned, we work with several different providers throughout the world. So they offer in-person training opportunities. And if you let us know your location, we can definitely help you out to find the closest provider. They can also travel directly to your site and provide training at your site. So definitely many options are available. I'm happy to get some more additional information and help you out after this call.
Thank you, Daria. We had something else in the chat. We have someone from Ethiopia, and they're mentioning that there's no international payment systems, and how can we help them? Jasmine, can you discuss other ways that they can make their payment?
Definitely. So in regards to payment systems, there's the option to pay directly through our learning management system that has the opportunity where you can pay via credit card, or we have online our option of paying via PayPal. If none of those options work for you, you can always email us at POCUS@intellos.org, and we can make arrangements to find a payment system that will align with your needs.
Thank you so much. I see questions about in-person, the cost for in-person training. We will send you the email for the application for any training request, and then you'll work with Daria, who can direct you in the right direction for our POCUS education providers. Thank you for adding that in there, Alex. All right, next question. Are CMEs available? Daria, can you take that?
Yeah, unfortunately, at this time, we do not offer CME for any of our educational offerings. But we hope that you still find our education helpful, and we offer, as I mentioned, many great resources, webinars, and you can still find them useful, but not at this time. We don't offer the CMEs.
Thank you, Daria. While we have you, Daria, can you also, someone had a question, does the POCUS Academy have an ultrasound school?
No, we do not have Ultrasound School, but we work with training providers or educators that have been vetted by our organizations for quality. So we highly encourage getting training through that network. And we're happy to guide you through your learning process and find you the best possible provider to work with.
Thank you, Daria. Next question. How do we get credit for all the courses that we have taken in the past? And I believe you're asking about either webinar courses or if you're talking about certification. So we'll answer both. I'll first have Daria answer about webinars.
So at this time, as I mentioned, we do not offer any credits for attending our webinars. But if you need the certificate of attendance, we can work individually with you. But again, we don't offer the credits, therefore there is no certificates. Thank you.
Thank you. And then for certifications, Lori and Jasmine, do you want to walk them through like some benefits of like what they can obtain from getting a certification after they successfully complete it?
Definitely. I'm going to start with just making sure that everyone understands as an organization, we are a credentialing organization and we provide that independent validation of your POCUS knowledge, skills, and abilities. We understand that POCUS journey includes education, but regardless of where you obtain education, if it's through any of our POCUS education providers or through other means, we feel that step to independently validate your skills is important. So by obtaining the certification, you are demonstrating to your peers, to your communities, more importantly, to your patients that you have a level of proficiency in your abilities to perform point of care ultrasound, which will ultimately impact the quality of care that you're able to provide and deliver. In addition, by obtaining your certification, you're elevating the entire cohort of point of care ultrasound users and elevating the level of care globally of POCUS users. So it's that ability to ultimately provide quality patient care, but elevate the standard of practice and care globally amongst point of care ultrasound users.
Thank you, Jasmine. Lori, I have one for you. What is the difference between POCUS certification and ARDMS?
Yeah, of course. So ARDMS and APCA, which is our physician council, they verify the depth of knowledge for a specific domain of practice, whereas the POCUS Certification Academy, we verify a breadth of knowledge which aligns with POCUS scans and decision pathways a clinician would need to consider for patient management in point of care ultrasound. So it's the depth versus breadth of knowledge.
Thank you so much for that explanation. We had a question come in. How can I get certified in POCUS on NICU babies? I am one of the NICU fellows.
So unfortunately, we don't have a pediatrics certification or certificate just yet, but we are in the works to develop that. So if you're interested in volunteering your time and expertise, please email us at pocus@intellios.org to volunteer your time.
And we would encourage you to definitely start with the POCUS fundamentals because, as we said in the presentation, we're rolling out offerings all the time. And regardless of what the offering is, that POCUS fundamental certificate and gaining that foundational knowledge will be required and will be useful with any setting in the application of POCUS. So definitely start with the POCUS fundamentals. And as Lori said, please reach out. We can't do what we do without our volunteers. All of our content is developed with the help of volunteers. So your expertise in that area could help us move forward the pediatric and neonatal certification.
Awesome. Thank you so much. And it looks like we have no more questions. So this ends our Q&A portion. And thank you, Daria, Lori, and Jasmine for your time. Thank you to everyone who is answering our learning score question. This helps us to plan our next sessions and receive feedback directly from you. A recording of this webinar will be made available on POCUS.org website in approximately 1 week, and you will receive a link via email. Thank you for attending our information session webinar today. We hope you found it valuable and insightful, and we look forward to seeing you at a future webinar. Contact us today if you have any questions.